Hi everyone, and thank you for being here. Today I'll walk you through the process of conducting a therapy session from start to finish. We'll, we will be covering four major stages. The first is identifying the needs for therapy. The second is preparing for therapy. The third is conducting the session, and lastly is the follow-up. Throughout this presentation, I will refer to social work disposition number 6, competency, and the ethical principles that social workers practice within their area of competency and enhances their professional expertise. So our first major stage is identifying the need for therapy. The therapy process begins before the first session. It comes with recognizing that therapy is needed. Clients may self-refer or they may be referred to by schools, doctors, court, or community organizations. There are common signs that will help the client, whether they're being self-referred or they were referred to by schools or doctors or courts or the community organization, that they need therapy. And this can include emotional distress, difficulty functioning in their day-to-day life. They might have experienced trauma exposure or major life transitions. As professionals, we use different assessments and screenings like the PHQ-9 or the GAD-7 to help us understand their presenting problems. It's very important in this stage that we include evaluations because this will help us to tailor the client's needs that will match our professional scope and our competency. And if we're unable to help in that area, we're able to refer clients to an organization or to a different social worker that has that competency, which will help the client get the help that they need. Our second major stage is preparing for therapy. Once the need is identified and we understand the client's problem or what they're coming in for, that's when preparation is key. This can include reviewing referral information, case notes, and backgrounds. This also ensures a safe, private, and culturally sensitive space for the session. And we want to make sure that we're being trauma informed and have a client-centered approach in our preparation. And preparation isn't just for the client, it's for ourselves. In this time frame, in this area of preparation, we can sit down within ourselves and ask ourselves questions and reflections. Some reflections that we can do is asking ourselves, are we equipped for this client? Because we might feel it in our heart, or we might become emotionally invested in wanting to help our client, but if we're not equipped um, with competency, or we're just not equipped with it, it's not going to be beneficial long term for the client. And then we also should ask ourselves, do we need supervision or support? Because we want to give we want to have the best results for our clients, and sometimes having supervision or support can give us guidance or have us view the client's problem or what they're coming in for in a different light, and that can help us navigate navigate their navigate it in a different way. um, by practicing within our area of competency, it's not just ethical, it's very essential for the client's safety and giving them the best outcome that they can have. Third is conducting the therapy session. So I wanted to break this down into 3 stages. So the first stage is opening the session. So by opening this session, we want to first always greet our clients, welcoming them, welcoming them, creating a safe environment. Even in the beginning, we may not have what's the word I'm looking for? We might not have a true understanding of what a client might be going through, but we want to set the tone and set the space for them to at least feel that they are being welcomed. We want to build a repertoire and review informed consent and confidentiality. So within that opening session, we could get a sense, we could create a better sense of warmth and empathy that can help build trust and safety. And then in that time where we're just getting to know each other, we could lay down and explain about confidentiality and consent, and then open up the discussion of setting a collaborative agenda. So there's questions that we can ask, having open-ended questions like, what would you like to focus on today? This can set a collaborative tone and build trust. The second stage is discussing the issues. We want to allow the client to share their concerns, and as the social worker, we want to use active listening, empathy, and have a reflective response. And in that time, we can look for patterns, explore emotions, and identify strengths and challenges, and to remember that we want to stay client-led and keep our observations, objectives, and our questions open. Third, we want to develop a plan of action. So with the plan of action, once our client has discussed their concerns and made it clear on what their goal is and what they want to work with us together. This will help us be able to have a plan of action. And with this plan of action, um, this allows us to set goals. Um, this can include specific, measurable, attainable, relevant, and time bound. And then we can choose therapeutic interventions that match both the client's need and our own competency. So if we're if we have if we have the if we're equipped in areas like CBT, mindfulness, solution focused therapy, that's something that we can always bring attention to with our clients. But you want to always stay within your field because you don't want to give out something that you don't have the resource for, you're not equipped, because that's not going to help your client long term. And then you don't want your client to build a certain trust in for you as their social worker, and then you kind of let them down because you presented something in the beginning that you're not fully equipped with, or you don't even have, or you don't have the license or the education to do so. So you want to keep that in mind when developing a plan of action. It's also for the client and for yourself too. And lastly is our follow-up process. So therapy is an ongoing process, and it's not just a one-time session. And after the session, you want to remain relevant and effective. And after each session, you want to document clearly and ethically, reflect on what worked and what didn't, so that you can have a better game plan for next time. If you feel like maybe the client didn't like that, then you could have different plans in place to help them. You can plan the next session or check-in and refer to additional support when needed. If the client is ready to end therapy, you can help them do this by by helping them terminate ethically, review the progress, create a safety plan, please don't, and connect them to other resources. Follow-ups is very important because this can include checking in on outcomes and adjusting plans if needed. So with making referrals, you have to remember your strengths and your weaknesses. If you know that you're really, as a social worker, if you know that you're equipped in one area, like mindfulness or just different therapeutic measurements, you will want to kind of gravitate more towards that area. And if maybe you feel like a client can do better in an area that you don't have that expertise in, like like different therapeutic measurements, then you don't want to, you want to, sorry, I kind of forgot what I was about to say. Um, but you just have to know your limits and understand that there's people and there's resources um, that are there for your client and that you can refer them to. Um, um, you can refer clients to specialized care if it's needed, and it's important to coordinate with other professionals that can help them during this time of transition, and will have will that will continue to help them. Um, Social work disposition number 6, competency. Um, this means practicing within your scope, using evidence-based methods, and committing to ongoing learning. Supervision helps process complex cases and identifying blind spots. Self-reflection is bias and skill gaps allow us to continuously grow and provide high quality care. Upholding competency protects clients and promotes professional integrity. And this, in summary, a competent therapy session includes identifying the needs, preparing properly, conducting with empathy and skill, and follow up ethically. And throughout it all, we must remain professional. We must maintain professional competency. Thank you for your time, and I invite any questions or reflections now. Thank you. Did I stop it? I think I stopped it. I stopped it.